kind of like the basketball team when they run out the tunnel onto the field house floor, you know, and they hear the crowd roar, you know. Well, that crowd doesn't dribble the ball once, and it doesn't shoot a basket for them, and it doesn't blow a whistle. But just by supporting that team, it elevates their level of play.
What we wanted to do with the Advancement Board was to cast it in an entirely positive light, build everything that our dream would be about KU and the KU Med Center.
It was apparent to me that we really needed to form a group to do both of that, the outreach, the development, the just getting the knowledge of what's going out into the community.
We educate lots of effective, influential people throughout the community to tell the story of KU, and that's why we're number one.
We focused on heart, and we focused on Alzheimer's, and we were doing educational programs at our meetings.
Very quickly, we began to focus on the objective of gaining NCI designation for the KU Cancer Center.
Then we were able to coalesce on something really greater than all of us.
It was hard to put this advancement board together. Those of us that were there at the beginning, it was two different cultures, the hospital and the medical school.
The top hurdles, I think, have been our past, working through the med school and the hospital authority as they were pulled apart in two separate entities, and then putting them back together again in a smoothly functioning entity.
I've just finished reading Team of Rivals, and that's exactly what's going on here. We all have the same mission, but our paths are not the same.
We brought a diverse group of people, some of whom could barely say KU without choking.
I told them that the public could care less about that. It needed to be seamless. When they went out, it was KU Med Center, and it encompassed everything.
We were united to get it done. We just had to work at getting rid of some of the things that were getting in our way.
We had a great story to tell. And then the next step was to find the community leaders, people that could have influence out in the community with their opinions, educate them as to what was going on at the hospital, the successes we were having, and then have them spread that word through the community.
It was not just straight upward and onward. It was kind of rocky, but always going up.
We had some of the right people at the very beginning.
Bill Hall's, he's a good man. He's a good thinker.
Bill has been a very, very vocal supporter of not only the Advancement Board, but of KU in general.
But for his leadership at the Hall Family Foundation, you know, we wouldn't have many of the resources we do now.
Once you get great people, they find other great people, and that tends to grow the process.
The makeup of the Advancement Board are people that are committed to the Med Center, they're committed to the community at large. They are people who have a genuine place in their heart for doing good things.
We do have a team, and they're not a team of rivals anymore.
I don't know that I've ever sat down and tried to clearly articulate, you know, what would be a measure of success. That's almost to suggest that someday its job would be done, and I don't think it ever will be.
We're going to get people involved who are willing to give both their time and their talent and their dollars, and that's what we've put in place.
As we move to be a national leader, I think there's an opportunity to grow the Advancement Board even broader than Kansas City.
It's really a matter of what do the people of Kansas City, what do the people of KU, and what do the people of the Med Center really want to make it, because nobody's holding them back.
The leadership of the university and of the medical center and of the hospital have given people confidence in themselves. We think that in supporting them, we got a winner. We do a better job of treating people here. Our scientists do advance medical research. It seems that the hard work you put into being a member of the Advancement Board is repaid with the success of those you're supporting around you. The community, I think, is better for it as well.
There's no limit.